Just like the Haudenosaunee people showed how to do democracy in the right way, well, now we're showing how to do healthcare in the right way.
Native Montreal officially opened its first culturally secure family healthcare clinic in the Montreal region, with the aim of providing holistic and culturally appropriate services for the Indigenous community.
We've invited the healthcare system in our offices. That way, doctors, nurses can learn from our staff how to practice better services to the Indigenous community and collaborate with our staff for all the other needs.
The clinic will be open Monday to Friday from 9 to 5 and will be offering services to families, children, adults, and seniors. Some services include medical consultations, blood work, mental health services, as well as meeting with Indigenous knowledge keepers.
Right now, since we only have a part-time doctor, we're only able to take a few hundred patients, and so the next stage is including about 50 new registries.
The clinic will also be providing health navigation services, members that will help with booking appointments, guiding a patient through the healthcare system, or in some cases, accompany them during appointments.
In health, we don't have this customer service follow-up usually. And I think that's the reason I'm saying this navigator principle is a good example of my vision of customer service or patient service that we need to have all across our health system.
In September 2020, Joyce Echequan, a 37-year-old Atikamekw woman, filmed her final moments in a Quebec hospital as healthcare workers made racist comments toward her. A coroner's inquiry found that racism and prejudice played a role in her death. The incident caused anger as protesters demanded Quebec acknowledge systemic racism in the healthcare system. Last year, Quebec passed Bill 32, which says that health and social service institutions must treat Indigenous people better, including giving staff training on Indigenous culture and history.
After all of the decades of negligence that has happened towards our people, racism that they've experienced, and institutional harm that they've experienced, let's say through DYP, well, of course, a lot of us do not want to access these services. We're afraid, literally, to access certain institutions. And so by including them in here, they become an extension of our community.
In collaboration with Quebec's health ministry and the ministry responsible for relations with the First Nations and the Inuit, Native Montreal is hoping more clinics like this will be opening throughout the city.
And all the learning that's going to happen is also going to be shared across the province. So it's going to evolve and it's going to improve.
In
In Montreal, Swidda Rassy, City News.